Menstrual cramps. Period pain affects a substantial percentage of women at some point in their lives, and it is one of the most prevalent reasons for women seeking medical help. Due to dysmenorrhea, the discomfort associated with menstruation can range from mild to severe. Menstrual pain can be felt in the lower abdomen, back, or thighs, and it can be accompanied by headaches, nausea, dizziness, or fainting, as well as diarrhea or constipation. What causes menstruation pain? The inner lining of the uterus produces a hormone called prostaglandin during menstruation, which causes the uterus to contract, often painfully. It is possible that some women's bodies create more than normal amounts of this hormone, or that their bodies are more sensitive than usual to the hormone, which causes extreme cramps and discomfort during menstruation. Dysmenorrhea comes in a variety of forms. Dysmenorrhea comes in a variety of forms, including 1. Dysmenorrhea for the first time. It is a term that is widely used to describe pain related with menstruation that is not caused by any known or evident physical abnormalities. This symptom appears to be more common in women between the ages of 20 and 24, and it normally goes away after 1 to 2 years when the body achieves hormonal balance. Secondary dysmenorrhea is a type of dysmenorrhea that occurs when menstrual pain caused by a physical disorder other than the menstrual cycle is referred to as this term. Symptoms of menstrual pain. Menstrual discomfort might cause the following symptoms. Fever. Nausea and vomiting are common side effects. Vaginal secretions are a type of vaginal excretion. Backache. A stomachache. Aches and pains in the legs and feet. Menstrual pain, causes and risk factors. Period pain is particularly common in teenage girls who have only recently begun menstruation. Dysmenorrhea can be caused by a variety of diseases and physical issues, including the presence of cells in other sections of the abdominal cavity that resemble and act like endometrial cells, or these cells evolve into muscle tissue in the uterine mucosa that penetrates the uterine muscle fibers. The pain usually begins 1 or 2 days before menstruation begins and lasts for the whole of the bleeding days. Non-cancerous benign tumors in the pelvic area, such as ovarian cysts, polyps in the cervix or inside the uterus, the formation of a muscle tumor, or a benign fibroid. Infections in the pelvic area, where the risk of infection increases at the start of the menstrual cycle due to the expansion of the uterus during menstruation, and pelvic infections caused by sexually transmitted diseases can occur at any time. The use of an IUD, as using an IUD might make menstruation more painful, especially during the first month of use. Other forms of contraception. Obstacles to pregnancy. Uterine congenital abnormalities, such as the constriction of the uterus's bottom half, which is attached to the vagina. Dysmenorrhea can also occur as a result of medical operations like burning, cooling, conization or cone biopsy, radiation, endometrial biopsy, or IUD implantation. Other symptoms connected with the menstrual cycle, such as weight gain, headaches, and psychological tension, might emerge before the menstrual cycle begins, and PMS, premenstrual syndrome, can be the cause. Menstrual pain diagnosis. Other tests, such as, if your doctor feels a condition is causing your period pains, he or she may recommend ultrasound. This test creates an image of the uterus, cervix, fallopian tubes, and ovaries using sound waves. Magnetic resonance imaging, MRI, used to provide detailed images of inside organs. Laparoscopy. While laparoscopy is not normally required to diagnose period cramps, it can aid in the detection of underlying conditions such as endometriosis, adhesions, fibroids, ovarian cysts, and ectopic pregnancy. Treatment for menstrual pain. Menstrual discomfort can be treated in the following ways. Therapies that are not conventional. Include the following in your list. The use of heat to relax, such as hot water bottles, heating pads, or a hot bath, with caution to avoid burning the skin. Exercising on a regular basis. Physical activity on a regular basis may aid with pain relief. Behavioral changes as a result of treatment, such as hypnosis and desensitization sessions, which aim to change the patient's behavior in order to relieve pain. Changing one's diet to include more veggies and less fat, as well as taking vitamins like vitamin D, vitamin B, and vitamin E. Acupuncture and Chinese medicine are examples of alternative or complementary treatments. Treatment of the pelvic nerves with neuroelectrical currents delivered through the skin. Surgical treatment to sever the nerves that produce discomfort during the menstrual cycle in the pelvic. Treatment with drugs. It is accomplished in the following ways. Nonsteroidal anti-inflammatory medications, NSAIDs. Oral contraceptive medications, injections, or devices implanted inside the reproductive system that contain the hormones estrogen and progesterone. Inhibitors of phosphodiesterase. Menstrual pain prevention. Dysmenorrhea can be avoided if a woman follows these steps. Limiting caffeine, alcoholic beverages, salt, and sugar consumption. Stick to a moderate exercise routine and get 30 minutes of physical activity 4 or 5 times per week.